One of the key advantages is that you can do multi-site studies. You can build very large studies because over 12 or 15 years now, investigators at different CRN institutions have come to agreement. It hasn't been easy, but they have come to agreement about data fields and how to define data fields, and then agreed within their own institutions that they'll collect data in the exact same ways and label those variables in the exact same ways. So you can do studies now, both archival studies and then primary data collection studies across CRN sites, and thus achieve much larger patient populations than you otherwise would if you're just, for example, at a university.
Why can't I buy a CRN data set like I can buy a Serum Medicare data set? So I think the first principles are, we're not a data set. What the CRN allows you to do is to do clinically relevant, policy relevant research within a care-based setting. We're not just producing research data sets. We are the insurer. We serve as the insurer, the provider, and we're the embedded researchers. So we have a much higher fiduciary duty with respect to human subjects protection and with respect to how our data is used to protect confidentiality. So our data is far richer than what's available in publicly available data sets, but at the same time it is more complex to deal with.
So my project was called the MENU study, and it was one of the few behavioral intervention studies in the Cancer Research Network. There were 5 sites, and we put together an intervention to try to get people to increase their fruit and vegetable intake. There were some things about the CRN that really strengthened this study. For one thing, we had a defined population, so we knew we had people to invite to be in the study. We sent them a personal letter signed by their doctors, and the people that chose not to participate, we could describe them, which makes the study a lot stronger. We also were able to have a diverse group of people from across the country representing different ethnic groups, different ages, different geographies. We had really good retention in this study. It was like 90% of the people that were in it stayed in it, and I think it's because they identified with the plans they were in, and so they decided to stick it out, and they were loyal to us.
Through our understanding of the healthcare systems in which we operate, we can actually track patients across different types of care within the same setting. We also have a better understanding of the specific pathways that patients take through their cancer care, and all of that informs the richness of the research that we do. So that when we're looking at data, for example, on patient outcomes, we can better understand where those outcomes are coming from and where there might be important points of intervention.
So the projects that I have focused on usually involve medical imaging. I'm a radiologist, and I want to know who's getting tests, why are they getting tests, and a lot of those patients are cancer patients, and a lot of those patients are not cancer patients, and there was no other population that I could think of that would allow me to get at that kind of broader look at the population. So I work at the University of California, San Francisco. We have a great patient population to study, but it's a select patient population. It tends to be a more tertiary population, and I don't know everything about those patients. Sometimes patients come into our system, sometimes they leave the system, and I can't really describe their whole experience. Where in the CRN, I have an understanding of when patients come in, when they leave, and I can describe everything about them.
Because we have these relationships with providers and operations leaders, we can then take what we learn from our research, communicate it to those individuals so that they can then develop healthcare systems and strategies that are specifically designed to improve outcomes for cancer patients in those settings. So it's a unique opportunity to not only leverage the unique data sources that we have available to us through these relationships, but also to influence positively the outcomes for cancer patients that we're studying.
With health reform, there is increasing interest in understanding how healthcare is organized, how it's delivered, ways of improving quality and efficiency and value, reducing harm, reducing disparities. These are all questions that relate to healthcare delivery. The CRN institutions provide a nice, diverse sample of delivery systems that allow us to study these questions in a way that is efficient.